What is a urinary tract infection, UTI, in children? A urinary tract infection, UTI, in children occurs when bacteria, and occasionally viruses or fungi, infect any part of the urinary system, including the urethra, bladder, ureters, or kidneys. It's a common condition in children and can be serious if untreated, especially when the infection spreads to the kidneys. Types of UTIs. 1. Lower UTI, cystitis, infection limited to the bladder and urethra. Symptoms include frequent urination and discomfort while peeing. 2. Upper UTI, pyelonephritis, infection spreads to the kidneys. Often more severe with symptoms like high fever, back pain, and vomiting. Causes of UTIs in children. 1. Bacteria. Most commonly caused by Escherichia coli, E. coli, from the gastrointestinal tract. 2. Risk factors. Poor hygiene. Bacteria from the anus can spread to the urethra, especially in girls. Urinary stasis. Holding in urine for too long. Constipation can compress the bladder, preventing complete emptying. Structural abnormalities. Conditions like vesicourethral reflux, VUR, or a narrow urethra can increase the risk. Uncircumcised boys. Higher risk in infancy due to bacteria under the foreskin. Catheter use increases the likelihood of bacterial entry. Symptoms of UTIs in children. In infants and young children. Fever, often the only symptom. Irritability or fussiness. Poor feeding or vomiting. Failure to gain weight. Unusual smelling or cloudy urine. Diarrhea. In older children. Frequent urination or urgency. Pain or burning during urination. Abdominal or pelvic pain. Bedwetting or accidents after being potty trained. Back or side pain suggestive of kidney involvement. Fever and chills if infection has spread. Diagnosis. 1. Urine sample. Clean catch method for older children, collecting a midstream urine sample. Catheterization or suprapubic aspiration for infants or young children unable to provide a clean sample. 2. Urinalysis. Tests for signs of infection, e.g., white blood cells, nitrites, bacteria. 3. Urine culture. Identifies the specific bacteria causing the infection and determines the most effective antibiotic. 4. Imaging, if necessary. Ultrasound, to detect structural abnormalities or kidney involvement. VCUG, voiding cystourethrogram, identifies vesicourethral reflux, VUR. DMSA scan checks for kidney damage after recurrent infections. Treatment. 1. Antibiotics. Oral antibiotics are typically prescribed for 7 to 14 days. Common antibiotics include amoxicillin, cefixime, or trimethoprim sulfamethoxazole. Severe infections, e.g., pyelonephritis, may require hospitalization and intravenous antibiotics. 2. Symptom relief. Encourage plenty of fluids to flush out bacteria. Over-the-counter pain relievers, e.g., acetaminophen or ibuprofen, can help with fever or discomfort. 3. Address underlying causes. Treat constipation or ensure proper hygiene practices. If structural abnormalities are found, surgical intervention may be required. Complications of untreated UTIs. Kidney damage, scarring or permanent damage from repeated infections. High blood pressure, related to kidney damage. Sepsis, a life-threatening infection if bacteria spread into the bloodstream. Growth and development issues. Chronic infections can impact overall health. Prevention. 1. Good hygiene practices. Teach girls to wipe front to back after using the toilet. Regular bathing with mild soap to maintain cleanliness. 2. Encourage regular bathroom breaks. Avoid holding urine for long periods. 3. Adequate hydration. Promote drinking plenty of water to help flush the urinary system. 4. Treat constipation. Encourage a high-fiber diet and adequate hydration to prevent constipation. 5. Proper toilet training. Ensure children fully empty their bladder when urinating. 6. Avoid irritating products. Avoid bubble baths or harsh soaps that may irritate the urethra. When to seek medical attention. Persistent fever without an obvious cause, especially in infants. Painful urination or blood in the urine. vomiting, dehydration, or poor feeding, recurring UTIs, or infections that do not improve with antibiotics. Would you like more details about UTI prevention strategies or treatment options?